Well, greetings again. This is Dr. Bill Wyatt, and we're going to talk about, we're in adult orthodontics. This young man is an engineer for some company, and he has had a problem all his life, and he just finally decided to try to do something with this. And so we studied the models. You can see many things that have taken place to make his teeth go like they are. And that's what I want you to understand. You can look at somebody's models and tell many things that they did wrong here and how they could have been prevented in that. So just follow me through with this case. And this guy's an engineer now, a very knowledgeable person. And let's get in here, and I'll try to get through. This is 08 when we started, and this is where we kind of finished the guy out to this point. You'll have to remember that back here. We'll get in here and show the models in just a minute. And how we enlarged and brought it down and tried to restore the situation like it originally should have been had he not been doing these things that were wrong. Now this is 06. And here is the young man, and you'll notice the chin is kind of off to one side, and very fine guy, just a real nice guy, and I'm glad we could help him. Now, and this is the way when he smiled, he had a tongue thrust problem, and he pushed his tongue in there, and he made a gap in between the teeth. You couldn't get them together, and the chin wasn't out where it should be. That'll help some, but we can't change that too much. Now here we look at the models. The teeth are hitting cusp to cusp. Now what creates that in an adult or created while he was growing up, you see? And he's got a little defects, see the enamel on the tooth is kind of messed up here. That happens on some people having a sick spell when they're young like this. Now, this is just confirms that he's a mouth breather. In other words, he's got allergies and things are wrong with his nasal cavity in there, and he's breathing through his mouth. And when you breathe through your mouth, your tongue has to be in the bottom arch, and the bottom arch, that ought to be smaller and fitting underneath the upper arch will go out, and where you're hitting cusp to cusp, and then a lot of people will shift their jaw to one side or the other, and it's fouled up, and it'll be that way the rest of their life. All right, you got to get older people that have this breathing problem and go in and widen their maxilla up here. Well, a lot of these people, you say, well, I can't separate you with a palatal separator, but you can, now we use these big arch wires on the outside, and we put torque in the upper teeth to keep the roots out against going out to the buccal when you bring the crown out like that. And we'll try to go over that in another day how we do that. Now that he pokes his tongue through here, he's kind of swallowed improperly, and that's causing that problem. Now you're going to see these defects in their teeth to some extent here. All right, this is out to a position where the cusps are hitting the cusp instead of the bottom teeth fitting into the groove of the upper teeth. So your upper tooth ought to be something like this, and your lower tooth would come up, and this part of the lower tooth would go out in here, and that keeps you from biting your cheek. Now, I'm a mouth breather, and I didn't have that fixed. It was not bad, but I bite my cheeks, and I have to, when I'm eating, I put food between the cheek out here where I can chew without biting my cheek. But that's what happens. This spreads out, and you think the tongue won't move your teeth. It can move them all over the place, and that is a fact. All right, the other side is almost in a crossbite there. And so we're going to have to restore that kind of like it was originally. So you see how narrow the upper arch is. In other words, he's swallowing and he's pulling his lips together. The swallow problem is not developing the upper, because he's sitting there breathing through his mouth all the time. And so the upper arch doesn't get wide enough. And you see this narrow arch. This arch ought to be coming way on out like this. It wasn't pretty well back at the back, but these areas up here are too far in. The lower arch, now the tongue's fitting in here, and you think it won't move these teeth out, but it sure does. It moves it out, and he's not swallowing properly. He's got that open bite there. And so we here is 07. Now, we go in and we expand that out. In a few minutes I'll show you where we use a palatal separator. Now, we probably didn't get the sutures moved out like we should, but you can expand the palate. Even though you don't get the sutures to come apart like that. And I'm not sure they didn't come apart on him. Now you see the lower arch is that, and we'll spread the upper arch out, or it comes over it. Here is this deal in 06, and we've separated that and moved this out quite a bit, and we'll continue to go, and we're going to get this thing rounded out like that and bring those teeth back. That's just another view of the palatal separator in there. Now, if you're using palatal separators, you just put a bar out here, and you've got this tooth welded. It'll pull the roots out here, but where you have a bar on it, the tooth, instead of you pushing on it like that, it'll just kind of lead. The root will go in, and the crown will go out, and that's not what you want, because your airway is up here. You got to bring the roots out to get the airway in there. And so here the lower was wider, and it's fitting right cusp to cusp, and some spots have got a kind of a cross bite. There's the upper arch, you see, when we started. And the tongue pushes through here. Now we went in, and I showed on a deal that it was the amount of the distance that was taken on the side of the upper 6-year molars. I guess that's what we're on right here. And I think the next one, we widen that out, and you put this, and you see how much further along this needle goes all the way around over here. And I'll go back, and you can see where it was there. So we widen this upper arch out, and you can widen the arch on anybody as long as they're living, and just as it doesn't have to be. Of course, once you're dead, you can't do anything with it, but you don't want to do it then. But you can expand and bring it in the arch. You can do any kind of movement. We have worked out a system in here where you can do any movement of the teeth that you really need to do. And I hope you adapt that. We use a lot of straight wire stuff, but we add some things to straight wire in there. All right, that's 08. Now here's his teeth are now. His upper teeth are fitting over the lower teeth, and the cusp of the buccal cusp of the lower arch is coming in the groove on the upper arch like that. I don't think, now this is a distorted picture. This is leaned in like that. But here is the, he's got some defects in some of the enamel. He had, when he was a child. Now this is, he's cracked this crown off of this area right here. And that'll have to be repaired. All right. But there's where we brought this upper arch out to that point. I'm sorry I lost this. We brought it out to that point. And now those teeth, there's something wrong. They'll have to be crowned or worked on the teeth over here on that side. And I thank you for watching. And what we've tried to do in here is to restore the teeth to what they originally were. If you look back where we put the arches in, they were much more narrow than that, and we widened those arches out, and now the airway up there is greater, and he can breathe through his nose better and everything. So thank you for watching, and I'm going to close out, and I hope that you learned you can pick up a lot of the reasons for these things by just studying the models. Bye-bye. Join our group and subscribe to our channel too. Thank you.